Look out! It's a Sparrow Pictures.
Snippet.
In early February of 2020, before COVID-19 had reached, or SARS-CoV-2 had reached Texas, there was no talks of it being in Texas yet. We live in Dallas, Texas. My father-in-law walked into a hospital in Dallas with fever and headache, and the actual hospital diagnosed him on day 1 with the flu. Day 2, they called us to tell us he had pneumonia. Day 3, they called us to tell us now he has acute renal failure. By day 5, they called us to tell us now he was going in and out of consciousness. And that's when my wife and I went up to the hospital for the first time to go see him, only to find out that I looked up and noticed that hanging from the actual IV rack was an actual antibiotic called vancomycin. And this troubled me because if he was diagnosed with the flu 5 days earlier, antibiotics are not warranted in viral diagnoses, which the flu is a viral diagnosis. So over the next 12 hours, I came back the next morning on day 6 to find out from the medical doctor. I wanted to know what they tested him for on day 1, go through all the pathology reports, only to find out he never tested positive for influenza A, influenza B, never tested for viral or bacterial pneumonia, which they called us on day 2 and told us he now had pneumonia. So now I'm looking at these flagged negative reports, and I just asked the medical doctor up front, why did you say he had the flu? And they said, well, basically we believed it was a false negative test. And I said, well, even if it's false negative and you believe he has the flu, why did you put him on vancomycin, which is an antibiotic? Antibiotics don't treat viruses. And his response was, it's hospital protocol. But Dr. Ardis, that's not the only antibiotic we have him on. We actually had to put him on 2 other antibiotics as a part of this hospital protocol for the flu. And I said, but you called us on day 3 and told us he's now in acute renal failure or kidney failure. I said, and you know vancomycin causes acute renal failure, and you've had him on that since day 1. I said, you've got to get him off that drug, because from last night when I was up there, the evening of night 5, he had actually put on an additional 10 pounds of water in his belly. His belly looked like a waterbed. And anybody who knows anything about acute kidney failure, when you have an IV bag putting water into your body, your kidneys are responsible for excreting water. And this is very important when it comes to the remdesivir COVID-19 treatments. When you shut down the kidneys, that's the only major organ that releases water from your body. When you can't release it because you have a drug shutting them down, your abdomen starts swelling with the water. It then infiltrates and fills up around the heart, inside the sac the heart sits inside of, called the pericardium, and then it floods into the lungs, and you actually drown patients to death. So I actually asked him, show me the x-rays from day 2 where you diagnosed him with pneumonia, because on day 1 he didn't test positive for viral or bacterial pneumonia. He pulls up the x-rays, points at it and says, there's pneumonia. And I said, where's pneumonia? Pneumonia looks like cauliflower appearances or shards of glass appearance throughout the whole lung fields. And none of that existed on the x-rays. All you saw was a straight line of water in the lower lobes of his lungs. That is called pulmonary edema. So now he had a false misdiagnosis of the flu because he didn't test positive for it. Then he was diagnosed with pneumonia, which was actually pulmonary edema. And I knew they were using a drug called vancomycin to cause acute kidney failure, flood his lungs with water, and they were drowning him to death. When the water by day 5 got to his brain, it was putting pressure on his brain, is when he was going unconscious. So I'm screaming at them to actually take him off of vancomycin, which they actually agreed to do. I actually asked them to put him on Lasix, a diuretic, to get the water out because they hadn't been giving it to him for 6 days for some crazy reason. And the medical doctor thought, before I had him show me the medication schedule, he actually said to me, of course we're giving him Lasix every day to keep the water out, only to be shocked that it didn't show up on day 1, day 2. It was at the lowest level, 20 milligrams on day 3, none on day 4, none on day 5. And every day he pointed at it, he was like, I thought we gave it to him then. I told him to go out to the nurse's station, get it right away. They gave it to him for 4 hours, and over 4 hours, he lost 20 pounds of water. Respiratory therapist came in to evaluate his lungs that he's been doing every day for the last 4 or 5 days. For the first time, no crackling, no mucus, no gurgling in his breathing. They were able to take the mask off without forcing air into his lungs, which they had been doing for the last few days. So he was breathing on his own. So we got them to use the Lasix, told them to use it every day. Then we find out that night, 9 o'clock, when my wife and I get home. The hospital administrators and the attending doctors called my wife to tell them the hospitals decided to stop all Lasix treatment permanently. And this was to cover up liability that we were proving that what we were asking for was actually reversing the scenario of death that they caused. That day I went up there and I was screaming at the hospital administrators, or not the administrators, the nurses station, the attending doctors. They actually pulled on their white coats and said, our medical training is superior to your chiropractic training. And I said, oh, really? Look in that room and tell me, is he better off now than when he walked in here 7 days ago? If you can tell me your hospital protocols and your medical education have made him better over the last 7 days, I mean, he walked in here with just fever and a headache. Now he's unconscious on a mask, having to breathe oxygen because you've caused acute renal failure with your protocols. And they would never say that he was better off after coming in there. They called security and kicked me out, and then convinced my wife's family that it's best to continue the hospital protocols, no Lasix, continue the 3 different treatments for antibiotics. And by day 9, remember, I was escorted out, banned. They were only going to talk to direct descendants. They convinced the family it was best to put him on a morphine drip and let him go peacefully with what's called palliative care. Now, palliative care is actually murder. When they say we're going to give your loved one morphine to ease his pain, morphine over a 2 to 4 hour period, which is what they do, is proven to paralyze your diaphragm so you can't breathe and stop your heart from beating. And this is how they set up the murdering protocols in hospitals to kill my father-in-law in 9 days.
Okay. Did you know that MyPillow actually has way more than just pillows? I mean, of course, they have pillows, but they also have blankets, slippers, towels, travel pillows, dog blankets, mattresses, sheets, and even more pillows. So to check out all of the things that they have over there, go to spiropillow.com and you'll get 66% off of your order today. But make sure that you use the promo code Spiro.
Hello, I'm Mike Lindell, and I'm excited to bring you my biggest bedding sale ever just in time for Christmas. Get my Giza Dream bed sheets for as low as $29.98. A set of pillowcases, only $9.98. Rejuvenate your bed with a MyPillow mattress topper for as low as $99.99. We also have blankets in a variety of sizes, colors, and styles. We even have blankets for your pets. Get duvets, quilts, down comforters, body pillows, bolster pillows, and so much more, all at the biggest discounts ever. I know my bedding products are perfect for you, and I'm extending my money-back guarantee for Christmas until March 1st, 2023, making them the perfect gifts for your friends, your family, and everyone you know. So go to MyPillow.com or call the number on your screen, use your promo code, and you'll get huge discounts on all MyPillow bedding products, including my Giza Dream bed sheets, for as low as $29.98. Get all your shopping done now while quantities last.